cases. So that's a 50% increase in a single day. I think the really important takeaways for our community about this is that we're starting to see quite a substantial ramp up in the number of cases, an acceleration of the number of laboratory confirmed cases. We've seen a substantial number of these cases be community acquired or under investigation. And the travel-related has really only been about half, just over half of the cases. And I'm expecting that we're going to see more and more in the way of cases that are community-acquired and not so much the travel-related. This is evidence that it is transmitting in our community. And we've also had a substantial number of people that have been severely affected by this, that they've either died from this or they're admitted to the hospital and receiving hospital care. So it speaks to the seriousness of this pandemic and how it's impacting those affected in our community. And I think it's also important that we have an incomplete picture of the people that are affected. For sure, there are people in the community who are infected that we don't know about, and they may be milder cases or they may be soon to present for assessment and be tested for us to find out, or they may be cases that have been assessed and told to recover at home but are unable to be tested because of the limited access to testing. All of this takes us in the direction of advising people that they need to be exercising the physical distancing that we all along, that people really think carefully about whether or not they need to go out into the community at all. And when they do go out, they need to maintain a 2-meter distance from other people. They need to be hand washing on a regular and frequent basis, given that that's the single most effective intervention that we have. That they need to avoid crowds. They need to certainly avoid anybody who appears to be ill. And if they develop any symptoms at all of a cold or respiratory infection, even something very mild like a sore throat, they need to be isolated in their home. Yesterday I was talking about people doing so for 10 days, and if they've recovered, they could return to the community. Now we're saying 14 days. This is based on recommendations that have come our way from the Public Health Agency of Canada. It's more precautionary, but I think people at this point onward need to be thinking in that very precautionary way to protect others and avoid others from becoming infected. And certainly healthcare workers, there's a greater onus on healthcare workers to know that they are not potentially going to infect other people. So if healthcare workers have had an exposure to somebody with COVID or traveled, they certainly need to remain in isolation 14 days. And if they develop symptoms, they need to be assessed. They need to be tested. If they test positive, then they need to remain in isolation until they fully recovered and had 2 negative tests 24 hours apart before they go back to work. This is all meant to protect the environment, workers, and patients. So now is a critical history in so that we avoid great surge and so that we can flatten the curve, as they say, so that we don't end up with so many cases in our community that it exceeds our ability to respond as a healthcare system. If you look at our case listing on our website, yesterday it took us down to 12, the first 12 cases on the listing. There were 2 more that I wasn't able to speak to that day, and you'll note that they're both males in their 40s, one of whom is recovering with self-isolation. The other one is hospitalized. Beyond that, we've got a woman in her 50s and a male in his 50s, both in self-isolation. Another woman in her 30s who's in self-isolation, a male in self-isolation. The woman in her 30s had been traveling, and the male in his 20s was We have other travelers in his 60s who are self-isolation who had returned traveling from Austria. We've in all of these noted that they live or are staying in Simcoe County, one of the municipalities in Simcoe County, and by that we mean it could be Barrie or Orillia as well. The case that you don't have listed here is an individual who's under investigation right now, and I don't have details on that case, but I can say that that individual lives in Muskoka. So this is our first laboratory-confirmed case of an individual.
Dr. Gardner.
An individual who's under investigation right now, and I don't have details on that case, but I can say that that individual lives in Muskoka. So this is our first laboratory-confirmed case of an individual from Muskoka. So at this point, I would be happy to take any questions with regards to the situation. You know what? I don't have that right in front of me, so I'm not going to speak to that, I'm afraid. But we.
Nope.
You have Mandy from.
Okay. Max FM, are you here?
Yeah, I'm Matt Sittler, yeah.
Oh, okay. Thank you. Doug Cross?
Yes.
Okay. Agatha? No. Nathan Schubert?
It's actually Brandon Piper with Moose FM.
Okay. And have I missed anyone? Chris Simon, you must be here.
I am here, yep.
And anyone else?
Yep, James Bowler from your TV.
Hey, hi, James. Anyone else?
Dawn from Huntsville Doppler.
Thank you, Dawn.
Don McNeil from MyFM, and I won't cut in line today with the wrong Don.
That's okay. Anyone else? Okay. Sorry, Matt, did you have a follow-up question for Dr. Gardner?
Yes. Dr. Gardner, can you tell us what threshold has to be met before you start opening assessment centers here in Muskoka? And if so, have those centers lined up, can you tell us where they will be yet?
You must be here.
I am.
Okay. Sorry, Matt.
Centers to proceed, and I understand that they're working hard to do so. I understand that they will be located in Huntsville and Bracebridge, closely affiliated with the hospital sites, but I don't know precisely that. And my understanding is that they want to get going very soon, whether it's later this week or early next week. It ultimately rests with the province to authorize them being open.
Okay, thank you. Sean Gibson, do you have a question?
Yeah, unless I've missed it, the 20-year-old, where is he from? What city are we able to get that information?
Unfortunately, right at this very, I think what I will do is make sure that I have that information at my disposal tomorrow. Right now, I don't have it right in front of me.
Okay.
Do you have a follow-up question, Sean?
No, I'll pass to the next one for now.
Okay. James Bowler, do you have a question?
Sorry, Kathy, I think I got skipped. Brett Glover from Barrie 360.
Okay, Brett, go ahead.
Sorry to interrupt. I just wanted to get mine out of the way. Dr. Gardner, we had 9 new cases confirmed in Simcoe County, Muskoka today, 100 of province-wide. What do you say to people who point to this as a sign that physical distancing isn't working?
I would say that the cases that you see today had their exposures at least 2 weeks ago, probably more. And so it's more of an indication of what had been happening in the past. What we do right now is going to bear fruit in terms of reduced cases going out forward in time beyond the next 2 weeks. So you've got to put in the effort now to make that benefit down the road. It really takes you to the importance, though, of acting in this way. We have to, without a vaccine, this is the intervention that we have at our disposal. The one thing that we can do is exercise this distancing to break the chain of transmission.
Do you have a follow-up question, Brett?
Yeah, actually, we've heard that some misinformation coming from the elderly who have gotten the flu shot and think that that protects them. What do you say to them?
Well, I'm always very encouraging of people getting the flu shot because influenza, of course, is a virus of major importance to the health of seniors in particular. And I'm very supportive of people in general getting the flu shot to protect everybody, but also to protect seniors in our community so that we can break the chain of transmission for influenza. But this the coronavirus, COVID-19, is not influenza, and so the flu vaccine actually won't help with regards to that.
Okay, thank you. Chris Simon, do you have a question?
It's actually been brought up to us a couple of times, not publishing the specific municipalities where these cases are being reported. I have actually spoken to them right up until today. I haven't today, but up until today I've answered that question every time. We have found that when you get very specific about where people live, that the focus becomes about that, and people have the sense that if they can just know what person to avoid, they're otherwise fine. And I think that's a dangerous view to take, because what you see with cases is the tip of the iceberg. And in fact, you've got community transmission happening, and people actually don't know who is case and who isn't. Therefore, you need to be aware of that and really take to heart and exercise the community, physical distancing practices that we're advising. So we've been wanting to get that idea across to people with our reporting, and therefore de-emphasize how local and specific we're getting with our provision. But with that said, I will make sure that I've got that information at my disposal. Okay.
Follow-up question, Chris?
Yes. It seems like we are just following what has been a trend worldwide in terms of the number of cases, the spike that we're seeing today. You can't be surprised by what you've seen, can you?
We are not surprised. We've seen the pandemic unfold. We've seen it progress from China and then to the neighboring countries, hugely impacting Europe, Italy being very much, unfortunately for them, the lead, and now the United States hugely surging to the south of us, and we ourselves are going through a steep incline. So we indeed are not surprised by it. We're very concerned about doing all that we can to flatten the curve for the public so that they can take action to protect themselves and their loved ones and others, and to encourage all levels of government to do the closures that they've done to really support the curve on this, and with Midland opening. So very.
So anyways, it's just ergonomically, things are challenging, but you just do it, man.
Yeah.
I don't know. You ask questions, and hopefully you get the right answers. And I try to set my shows and show files up the same for every band, so that I can get around consoles. So the learning curve isn't so high.
Yeah.
Once these things are set up, you have to be fast. Is basically the thing. Like I was saying earlier, like things are always changing, so you have to be able to react to the guitar solo or a singer dropping their microphone or whatever's going on. You have to be able to be quick and be on those elements.
Yeah.
And so yeah, that's part of the key, is to set anything that's new, to get it to be as close to the way your workflow is, the best you can, basically. Yeah. But it's not easy. Like I just was at a seminar the other day, learning how the newest ways to tune PAs and the new software, and you're constantly evolving. But that's, to me, the best. That's really the best part of this whole thing, is that it's always changing. Like you never have the same thing twice for the most part. Even if you have your show, on snapshots, so everything is the same, relatively consistent. It's always different. There'll always be a different room. There's always going to be another new piece of gear, or it's always changing, basically. And that's the best part.
Does the working with different bands, like I know you worked with Monster Truck, Monine, and now the new artists, do you find working with the different artists kind of increases your listening, or open up? Are you always adapting? Obviously you are adapting all the time to the different groups, but do you find even within the groups you're working with that you're kind of transitioning, or are they pretty well stuck in a sound that they want to get across?
I think that my forte is knowing what bands sound like, because I listen to so much music. Like I don't just listen to one style of music. I listen to everything, and I listen to a lot of music, and it's always happening. So no matter what band it is, I instinctively know what they should sound like. Yeah. Not what they should sound like, but what they sound like. And you just kind of want to get that across. If it's a loud guitar band, like make the guitars loud. If it's a more pop thing, you just make it sound how they sound, and it's easier to do that when you know what pop music sounds like, and where you know what rock music sounds like. Do you know what I mean?
Yeah.
And I pride myself on being able to do that, and quickly, and I've done a lot of festivals, front of house of festivals, where you're mixing 3 days straight every day, and every single band is different, and being able to make those bands sound how they sound really quickly, within a song, is again, that's kind of, I pride myself on being able to do that, and it's important to when I start to work with any band, I listen to their whole catalog, and some of it's great, and some of it maybe I wouldn't be that into, but I still listen to it, and if there's a cue that I think is important, that I think is integral to the song, I memorize it and have a cue sheet, and if anything that's important, you make sure that the song is getting across the way the artist intended it in the first place. And then as you develop over time, you start developing sound, you start figuring out what could be better, and you start improving things incrementally over years, and the longer you have with a band, the more opportunity you have to do that, and then you get to cultivate your sound, my sound, or their sound, and build it to be the best that it can be, And nowadays, because with virtual sound checks and being able to record shows, we can listen back to things. We can listen back to the show through the PA like they're playing, and I can simply say that part's not working, and am I doing something wrong, or is it something we can change up there? And we can analyze it pretty clearly.
Cool.
So there's no opinion. You know what I mean?
Yeah.
There's no it's not my opinion, or there. It's like, this is what it's doing, and you can hear it for yourself.
Yeah, it speaks for itself. Yeah,
maybe you like it out of tune, or whatever it is that's going on.
Each his own. What's your favorite city? Would you say that? I mean, you have traveled pretty well here, there, and everywhere. What's your favorite city to?
I don't know, man. There's cities that there's cities that when you go to, you feel like it's like a huge cultural, your mind is blown just by it being such a different culture. So, and I mean, there's so many examples. I mean, Tel Aviv is a really incredible city. I love going there. Istanbul was really wild. Tokyo is obviously one of my favorites. But there's also little cities like San Luis Obispo in California. I think it's like a really great city, and Barrie is probably my favorite city, to be honest. Oh yeah. I choose to, I was born here, but this is my favorite city. I love this city, and I love living here.
That's cool.
If I would say, out of all of those cities, this is my favorite city, because I choose to live. I could live anywhere. There's no real reason for me to be here except that I love it. Yeah. And it's a beautiful city. It's a great city. I love it.
Yeah. Well, speaking of the city, you do recording here at home as well, as we can see. Tell me a little bit more about how your input on recording might be different than other people who do recording in the studios. Obviously, I know that you have an incredible ear and a very wide, diverse taste in music. Do you find that's a big advantage to you, being out on the road and being able to hear different sounds to bring it back into this environment? Maybe it's a subconscious thing. I don't know.
I don't know. To be honest, I don't know.
Yeah.
I don't actually know the answer to that. I think you just react to whatever's coming out of the speakers, and I don't know that it's people that make records, and I don't profess to be that person. Like people that make the records that I love, I have just like the highest respect for them because it's hard. Making records is really, really, really hard, and I mess with sounds for the most part. Like I make little vignettes or whatever, and record my friends, and I can honestly say it's not my forte, but I love experimenting with sounds, and I take the opportunity here because I can to audition things, to compare and refine. So I can take 30 microphones and put them on a guitar cabinet and decide what their best use would be. So when I start working with the band, I hear what their guitar sound is, for instance, and I can apply what gets that guitar sound across the best, what makes it, for me, what would match that the best. And I can tell you pretty much on every level what would be the best microphone for that instrument or that performer, because I can take the time and experiment with things. And I can take the time I can import my show files, and I can time align things that need to be time aligned, like kick drums and snare drums, and I can say it's this many samples off, you know what I mean? Mm-hmm. And so yeah, it affords me that time, and I also use most of this stuff live. Like I bring, a lot of pieces are what I put in my front of house rack. So my vocal chains are all analog. My mix bus is all analog. I just pick and choose. My drums are analog. So yeah, I built a really expensive live rack. So when I roll in, I put my console on top of it, and my vocals go this way and through it and back in. It's I look at what people like Andy Meyer, people that mix like Justin Timberlake or Madonna, you know what I mean? At the highest level, I look what they do, and that's where I want to be. Like I want to hang with them.
Yeah.
And if they're using that preamp, which they do, which he does, that's why I have two of them. You know what I mean? It's like if they take the time they can have any gear they want. So if they're using it, it's probably what I should be using. Do you know what I mean?
Yeah.
Yeah.
I was going to ask, is the analog obviously sounds like it's still the way to go? Yeah,
hybrid, I would say. So
Yeah.
it's the mixture between analog and digital is kind of the thing right now. At least for me, it has been it kind of always has been.
Yeah.
I've always traveled with my own racks of gear. That's like, I don't want to show up and not be prepared for one thing.
Yeah.
And they're all tools, just like a mechanic. So I want to make sure I have the right wrenches to fix whatever, So I've since my first gigs with Bedouin, I brought my own racks of gear. I plugged them into the console, and I do that still today. I bring my own microphones, anything that takes the room for error, or brings that room for error down. That's what I try to do. For everyone, every band. I build my own XLR looms. Anything so I don't have to deal with other people.
I don't blame you. I don't blame you. Yeah, I don't blame you one bit.
Yeah.
Is there any artists that you've worked with in the past that you favor over others, or is there any experience you've had with certain artists, any pinch me moments where you've gone, this has just been the coolest gig, amazing artists to work with?
Well, I got to mix Daniel Lanois a little bit. He played with Tara Lightfoot. Did a couple songs with her at Massey Hall. That was pretty wild.
Yeah.
I'm a really big fan of his. So to mix him was kind of like, whoa.
Yeah, that's cool.
I don't know who else, man. I turned around one time on a stage and Elvis Costello was standing there.
Oh, that's cool.
I was just like, holy shit, that's Elvis Costello.
Cool. Yeah, that's cool.
But man, I don't know that I would get starstruck. I mean, if Sade walked in the room, maybe, you know what I mean? Something like on a level that's just beyond. But I get more like stoked to work with artists. It's like it's more about collaborating than to see where it goes.
Cool.
You know.
To finish it off, is there anyone who's in the music industry now, a musician who is in the same scenario that you are in, who wants to kind of transform into getting out of the performing industry and getting into what you're doing now? Is there any advice, suggestions you can give to anyone?
I think the advice that I would give to anyone doing anything is be reliable and show up. I think if you do those two things, you're more than halfway there for anything you do. And pull from past experiences. Like, I don't know, I don't want to sound like lame or anything, but like I was saying earlier, like my construction experience had more to do with any kind of success that I have than mixing bands, and I feel like that would translate to anything that I would do. It's like being able to like work with people and keep them motivated and safe, and you know, like those are really important things. And to be able to just work hard during the day and not be afraid to get your hands dirty. Like those are really the key to, I don't know, for me to like everything. Yeah. You know, it's simple. You know, just show up and be reliable. And
do your job.
Yeah.
Yeah. Well, thank you very much, Chris. It has been a pleasure to catch up with you. We have to do it more often.
Anytime.
Sometimes off the camera. We'll
next time we'll do it on the dock.
Sounds good to me.
Yeah, man.
Perfect. Sure. Thanks again, bro.
At Kawartha Dairy, it's been 80 years of fresh, delicious dairy products and 80 years of incredible memories. We've come a long way since 1937, and it's all thanks to our amazing customers. Thank you, Ontario. Here's to 80 more years.
Call the Rogers TV viewer response line, email us, or connect with us on social media. This is Rogers TV. Barry.
After involving Nuha in this program, she feels very confident. Here you have a lot of opportunity.
I learned a lot of stuff, like being kind and I'm more open-minded.
You have a brother in the 2nd Battalion. They're walking into a trap. Your orders are to deliver a message calling off tomorrow morning's attack. If you fail, it will be a massacre.
If we're not clever about this, no one will get to your brother. I will.
This is Rogers TV.